Sir, can you confirm that more hospitals are reporting an increasing trend of COVID cases as what some are posting on social media?
Correct. Actually, well, there's only one hospital and that's just circulating. That's a private hospital, and ang statement nila, some of their health professionals have tested positive for COVID. But if you look at our data, our epidemiology bureau, our utilization for hospitals are still very low for COVID-19. So hindi pa tayo tumataas. Although I'm watching the events unfold in Singapore, because I think in Singapore has reported an increase in not flirtations, but the new variant of variant under monitoring. It's a variant under monitoring. So hindi siya variant of concern, variant under monitoring. And tumataas sila doon. They reported an increase in cases, and it's filling up their hospitals. So we're watching ours. We still don't have that number. We're asking our doctors and hospitals to report antigen testing. Because ngayon, the testing is not PCR na. Diba? Rapid antigen na. So we're asking our doctors to report that to our epidemiology bureau. The one we're monitoring really is ILI, or influenza-like illnesses, of which COVID-19 is one of those, right? So we monitor that. Luckily, even the one in Singapore is mostly respiratory tract infection, ubusipon, common cold. So I'm not thinking border control, mandatory mask. I'm not thinking that. But I'm advising every Filipino, since that's happening, that can come here, yung minimum public health standards. If you are sick, you have cough, colds, sore throat, it's better to stay home. If you need to go out, wear a mask. So it's still personal. And then there was a question to me about, should we get vaccinated again? Because the Ministry of Health of Singapore was saying it might be waning effect of immunity. That should be a personal discussion between the physician and you, the one with the request for a vaccination. Because I think the ones that need the vaccination are only the high-risk people. Remember, we have 78 million people that were vaccinated with boosters. So I think they still have some level of immunity. So no requirement for border control, no requirement for mandatory masks, no requirement for additional vaccination. But we're monitoring the cases. So,
Sir, is it possible na itong strain na to or yung variant na to is also present here in the Philippines? And could you tell us more about this
yes,
strain?
it's possible. Although the variant isn't serious, that's why it's only classified as a variant under monitoring. Di ba, variant of concern, and then yung talagang dinideclare nilang public health emergency of international. So it's under a variant of monitoring. Mabilis siya kumalat, so they're thinking nagwe-wane siguro ang immunity. Sa Philippines, we don't have enough samples kasi we need the number of samples to do the genetic testing. So ang report sa akin ng Epidemiology Bureau, we don't have enough samples that can be used for genetic testing. Pag dumami yung cases, then we will ask our Philippine Genome Center to again look at what variant is spreading. Parang ganun.
Last na lang, sir. Sir, how should the public take these new developments on COVID-19? Do you consider this concerning na?
You know, I'll explain to you, coronavirus, which is the cause of COVID-19, is actually the cause of our common cold. Nagkataon lang in 2020, there was a variant that caused very severe illness, yung COVID-19 pneumonia, that caused the death of even healthcare workers, nurses, and elderly people. And over time, what happened is we got immunization from the vaccines that were developed then, but the virus itself also mutated to a weaker strain. So if you notice lately, even if people get COVID, magpa-positive sila, pero 3 days, 5 days, magaling na uli sila. Especially for the young and healthy, there's nothing to fear. You just isolate, self-isolate, take vitamins, paracetamol, and you should recover. Risk are the people who are elderly, with cancer, with immune compromise. Sila yung dapat makita ng doctor nila and have proper, meron tayong mga antivirals, di ba? Yung molnupiravir and Paxlovid. Those are things that can also be had for these cases. So ang advice ko pa rin is wala pa tayong general policies like we did before. Kasi noon, bago lang yung COVID eh. So, but now, because it's just one of them, one of the respiratory illnesses, my advice to the public is minimal public health precautions. So cough etiquette, di ba? If avoiding crowded places, ventilation of rooms, if the risk of getting it is going to be lower. Thank you.
Jinky Baticados, IBC.
Sir, follow-up ko lang yung kay Pia. Sir, following all these reports po, do we have now scientific basis for travel restrictions to any country? Kasi hindi lang naman Singapore, may India din. So, do we have now the scientific basis for that, for the restrictions po or travel ban? In any case?
No. As I said,
At
border
least para
control.
klaro lang sana.
Yeah,
sir.
para klaro, no? Border control. The Bureau of Quarantine is of course continuing to monitor this. Remember, may declaration form ka when you enter the Philippines. Pero online nga, yung e-travel, di ba, dinideclare mo yun kung may symptoms ka. So, binabantayan niya ng ating Bureau of Quarantine, which is under the Department of Health. So, we will have that data kung marami tayong turistang pumapasok na may respiratory symptoms and fever. But I will not recommend any border control. That means banning travel or whatever to Singapore or to India. The caution is precaution mo. You must be vaccinated at least, or if you're at risk, probably I'd advise don't travel there muna while they're having increasing number of new cases. Pero if you're healthy, maybe a regular mask that you bring along to protect you would be a good advice.
Thank you for watching Politico TV. Please like and subscribe to our channel for more videos.